Welcome back to Velsh and Rule. 1 week from tomorrow, the window closes for anyone who wants to sign up for Obamacare coverage in 2019.
And unless there's a rush to the federal website, the future of universal health care in the United States is looking pretty shaky. According to the Centers for Medicare and Medicaid Services, enrollment is down 11% over this time last year. Why the drop? Well, there's no individual mandate this year. There's no tax penalty that prompts people to sign up. In some cases, there are cheaper outside plans that don't offer as much, but they're much cheaper. And in some states, Medicaid expansion may be the reason. Unemployment is down, so more people have insurance through their jobs.
And there's another glaring explanation, a massive cut in Obamacare advertising. We actually saw this last year. Do you remember?
Look at that.
Shortening the period, shrinking down the ad spend.
Look how much.
Said it spent more than $110 million on promoting health care in 2017. But this year, it slashed the budget to just $10 million, a cut of 90%.
I think Mr. Pillow spends more money on advertising. Joining us now is Andy Slavitt. He's a former acting administrator for the Centers for Medicare and Medicaid Services. That's the government arm which facilitates ACA enrollment. And Andy, as one of my producers say, you are a one-person marketing effort for getting people who need Obamacare to sign up.
But if you needed Obamacare, why do you need advertising? Wouldn't you say, my gosh, I need to get my family covered next year?
It's a great question, Stephanie. One of the things we know is that people want to be insured. But what we also know, and we've learned this over the last few years, is that people need a little bit of help. It's a little bit scary for them, and they're not always aware. And you're exactly right in what you said, Stephanie, that the Trump administration's virtual stop of marketing is having a big impact. How do we know this? In the 12 states that control their own marketing budgets, 11 of the 12 of them have seen increases in enrollment this year. And in the 38 states that are controlled by the Trump administration, that's where we've seen the reduction. So we need to get the word out to people, as you said, that this really is their last chance the next week we have.
And if people have doubts about it, it is a little complicated. It's not the simplest thing in the world. But you go to the site and your eligibility will be determined if you go to it.
Insurance scares people. But what we've learned is that this is a really simple process. You go to the site. Doesn't matter if you've had a pre-existing condition. It doesn't matter if you've had any illnesses in your family. None of that matters. You put in your income and you're told what your choices are and how much you'll have to pay. In many cities, thousands of cities in this country, there are 0 premium options available. 80% of the people can find a plan under $75. People don't know that they can afford insurance because they're used to not being able to. And I think many will be pleasantly surprised.
All right, let me play devil's advocate or be a little brutal just for a second. $100 million in advertising, couldn't one make the argument, spend that $100 million towards taking care of people? Do we really need to spend that kind of money when it's to serve the American people?
It's a good question, but it's actually not taxpayer money. This is money that is actually paid to the government in the form of user fees by insurance companies for this express purpose. So the only reason not to spend it is not to save money. It's actually because you don't want the ACA to work. The reason that the user fees are meant to do this is so that more young people can become aware and the risk pool can be leavened. Yeah.
That makes sense.
Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.